right, what's up, everyone? Welcome back to the Spot Burn Podcast. We got episode 7. Today, you got your host, Dan, and
Bam Bam.
We also are joined by a very special guest, occupational therapist, certified hand therapist, Karlie. Karlie, how do you pronounce your last name? I forgot to ask you.
That's okay. Karlie Titus.
Karlie Titus.
Yes.
And this is going to be a fun one. Hopefully fun, funny, and very informative. We're going to keep it brief with the intro because we got a lot to cover, but the whole purpose of this and why Karlie is here is to talk about how we can help ourselves fish longer and harder without severe injury. We've kind of mentioned that a little bit. If you've watched or pay attention, you've probably seen me in all sorts of pinky casts and hand casts. You've seen them in the shop, probably wondering what the heck's been going on. We're going to get into all that today and then look forward a little bit on what I've learned really through this process, working with Karlie on how I can stop hurting my body so bad musky fishing. This mentally, I'm sorry, we're not going to cover that. Muskies suck. Mentally, we're all screwed. You're going to have to find a different therapist for that. This will be physical today.
Yes, exactly.
So, big thank you to you just off the bat for joining us in the dungeon and recording a podcast. This is going to be a lot of fun.
Thanks for having me.
For sure. All right, before we go too far down that rabbit hole, though, let's take a minute to talk about our awesome sponsors. First and foremost, Cortland Line Company out of New York, makers of some of the most awesome fly line of all sorts, trout, bass, and especially muskie. It is muskie season here in Wisconsin, so we have been spooling up and chucking the big stuff. I was just earlier this morning fishing the Sink 4 from the Pike Muskie series. 500 grain, that's a really good one. And we're big fans, so go check out Cortland Line, show them your support. We thank you guys for sponsoring. Next up, Stealthcraft Boats out of Baldwin, Michigan. You know, we've talked about it before. They got a full line of custom river boats, rafts, drift boats, jet boats, you name it. I'll keep it brief here because they just released an awesome video and many more to come. They've been doing some sweet marketing stuff, so go check that out on their Instagram or YouTube. And also, if you need a new boat, hit them up. Mike and Trevor will take care of you. Thank you for sponsoring, guys. As far as current events, we don't have any events. It's fishing season. That's the event. Get out there. Come hit us up at the shop. Online, if you have questions. The fish are biting, all sorts. Smallmouth bass, muskie. We're finally starting to fire up with the muskies post-spawn down here in Wisconsin. The trout fishing is still awesome. The carp fishing is awesome. So this is the time. Screw the yard work. The weddings are coming. You can cancel those later, but get out, get fishing, and let us know if we can help. That's really about it. We're going to get into the main event. I guess first and foremost, we really just, let's get to know you a little bit, Karlie.
Yeah.
What's your background? How'd you end up doing what you're doing? And what is it exactly that you do?
What do I do? Good questions. So I am an occupational therapist, certified hand therapist. About a year ago today, I took a test to become a certified hand therapist. Basically just, you have to have so many years of experience working with hand surgeons, treating patients, so many hours, and then you can study and take this test. So it's much more focused on upper extremity that I do. But I work here in Madison at SSM Health, and I work primarily on getting patients back to doing what they love to do with less pain.
How did you find this path? Was it something you always knew you wanted to do? Was there like a reason that you did it? You ended up here randomly?
That's a great question. No, like, I guess, special story, but I always knew I wanted to help people. For like my profession, I didn't really want to sit in a cubicle all day long, so I knew I wanted to help people. Specifically with my job, I love how I get to be creative, kind of make some splints, be creative with my treatment plans with patients. And then also like the science medical side of things too. It's like a perfect blend of two things that I'm passionate about. So
I got to experience that firsthand, which we will get into. Yeah, Karlie's seen all sorts of sides of me. Could barely hold my fist. Pretty much cried in a couple appointments. You name it. So maybe it's not just physical therapy.
There's a psychosocial aspect of what I do too, because just I see patients at their lowest and they're in pain, and that changes them as a person, and they're frustrated, and it takes a lot of time to heal. So, yeah. Well,
I'm going to say it a lot, but I thank you. I was fishing today, and I'm not bullshitting. That is partly because of working with Karlie. It was a long journey. I ignored it for a long time. But before we get into that, I guess just a couple more questions on, I know in getting to know you and working, you helping me, you have some experience with fishing too. So like you're from Wisconsin, I believe.
Yep.
Tell us a little bit about that. I think, and also clarify that like where you don't have experience, because I think that was what was cool, is you brought this like fresh perspective. You didn't have the kind of preconceived notions about all the craziness we do.
Yeah. So I grew up in Sun Prairie, Wisconsin, but my parents have a place up north in the Minocqua area. So I grew up going fishing with my dad when I was younger quite a lot. Not so much recently, but hopefully maybe I can get back to it.
After today, we met her dad this morning. We're getting him into musky fly fishing.
This is good.
Just mark my words.
This is good. We'll get him fly fishing. That'll be awesome. But I was just telling Josh that I did catch a muskie when I was 5 years old. So I have a little bit of experience in this world, but it was completely on accident. But
most of them are.
But it was a memory that's like super exciting, right? It was so much fun, bringing that fish in, and yeah, I'll never forget it. So.
Well, and I think something that's cool to hear you say that, because something we've talked about probably too much on this podcast, but just why musky fool, and we're here in Wisconsin, and you just hearing you be like, I caught one and I remember, and it's like a notable experience.
Yep.
Not everybody says that can actually do that, has done that. And usually when it happens, it's like, it sticks with you a little bit.
Exactly. Usually
like, no, thank you, I don't want that, or you ruin your entire life because of that. Not a ton of gray. But I guess it feels funny to ask these questions because I know the answer, but I think just having you on, like, how did we meet? And I think talk a little bit about, from your perspective, the state I was in from a physical, situation when we, and you don't have to be nice.
Yeah.
It wasn't great.
So Dan's okay with me sharing his experiences and when we met. So I want to say it was November, so like 6 months ago now, but Dan came in and he had, like, both sides were painful at that time. Correct me if I'm wrong, but it started like elbow pain, outside elbow pain. Then over time, maybe compensating with what you were doing fishing, traveled to small finger, which developed a tendonitis called trigger finger that some people maybe have heard of. And then because maybe you're overcompensating with that, he started getting dorsal, like, backside hand pain. So when I saw Dan, he could not make a fist. It was
not with my right hand.
So painful with the right hand, could not make a fist. Your grip strength was so weak. Your pain levels were so high. It was.
Yeah, I remember your reaction a little bit too. It stuck because it was like, you see the doctor, and when the doctor goes, "Oh wow," and kind of gives you like, you're screwed, like you're hurt. That was, I'm paraphrasing, of course, and maybe embellishing a little bit, but it was kind of like that. You were like, this is not good.
No, yeah, you had it on like all sides. So it was like, okay, my brain is like, my wheels are turning. It's like, what's the plan here? There's a lot going on, and clearly you've gotten to this point, whatever it is in your life you were doing.
Yep.
So you kind of opened up about fly fishing and everything you love doing, your passions, and so that just kind of helps me kind of make that plan going forward on how to rehab.
And a little bit from my perspective too, just for folks who are listening and maybe experiencing these things or on their way to experiencing these things. It started almost a year prior to meeting Karlie. The pinky locking up, hands getting stiff, elbow flaring up, but like manageable, but it was painful. And I think, as she stated, like, started to compensate. You fished with me in 2022. I literally fished like I was drinking tea in England. I was holding the rod with my pinky out because it would just lock up. I started two-hand casting because my right arm was hurting so bad. So all sorts of different things that really... The thing I didn't stop doing was fishing, which is part of the issue. Because it really, by the end of last season, right after the Treelands Muskie tournament, is when I came to Karlie, and it was bad. I kind of had that realization of like, I can't, holding a cup in the morning or something like that, or even just wanting to go tie a fly or type on the computer at work. It was like actually totally impacting me, for sure, not allowing me to really fish. And I remember that because that's when we got a lot of props on the table. I've acquired these since November.
It's like we're in the
Carly's got a lot of
therapy room.
toys. Yeah, and they all help. But I remember rowing my wife and one of our guides down the river after we met, and I had both of these on.
Oh,
and I
that's
wasn't
good.
fishing, but I was like, I'll row you guys, and I just had these like claw. It was pretty hilarious. I stopped fishing for a while,
It
but
kind of locked you up. I made you rest by putting you in these kind of bigger, bulkier splints. But just with what you had going on, kind of targeting the backside and the front side of the hand, ironically, I would put you in the same splint for both of those situations. So that was like the first thing, like, we got to get you in this kind of like what I call like a hook fist motion. And that's why we kind of locked you up. So.
Yep. And I guess deeper into that, what from from your perspective, which is what we care about today, what did you see as some of the like other causes, or talk about some of these like injuries specific, like why was I experiencing the hand pain, the elbow pain? I mean, I can guess, but I'm full of shit most of the time. So,
well, I think just with the flare up of the elbow, when you just overgrip, have too much tension in your hand, and you're trying to compensate for more proximal pain, that's when it's going to shift down the like kinetic chain here. So, and then when the elbow started to hurt, you were overgripping with your pinky, which set that off. So.
And then stop drink,
and then pinky out, and then your pinky is your powerhouse. That, like, people don't realize your pinky is like 50% of your grip strength. So to eliminate pinky and then put all that force then on the like adjacent fingers there, were just setting off all sorts of like compensatory motions, like increasing inflammation into your body in certain planes, and just ideally it's probably coming from your cast technique, which I'll kind of deep dive more into.
Which is shit, by the way.
What I want you to look at and think about when you are casting, because we're creatures of habit, regardless of whatever it is that we're doing in our day-to-day. So just having you guys be mindful of some of the stuff in the research I found to just help you think about what parts of your body and how to less strain them.
Yeah. What would I like for someone else listening too? Was it's probably an obvious question, but something that would have been much easier to address and heal had I seen
Sooner.
you 9 months earlier, 6 months earlier, 12 months earlier.
Yep.
Like if it was just the pinky.
Yep. Or just if it would have started at the elbow. Like that's just so much easier to calm down. Usually, so we can classify things as acute and chronic. As soon as something has been 3 months or more, then I call it more chronic. And then it's a little trickier as a therapist to get things to calm down. But if I have a patient that comes in, they're like, hey, this just started a month ago. I'm like, sweet. I can just get things to calm down a lot faster because your body's not in that inflammatory, painful response quite as much, or you're not compensating and causing other injuries. So, yes, ideally, the sooner the pain sets in, the quicker you can maybe see a hand therapist would be ideal for sure.
Yeah, I mean, I would totally like shake whoever I could to say, see that hand therapist, because my next question is the recovery you put me on. I mean, it was, I know I got frustrated, not at you, just at like, was like everything needed to be, it couldn't type, I couldn't, wash dishes, right? Yeah.
Those
that's right.
things,
that like re-triggered it. Yeah, that's
you
right.
Squeezed a sponge too hard and it offset that pain again. So, just that rehab plan is lengthy, and the sooner you can get in, usually the sooner we can get things to calm down for sure.
And from like a high level, is it fair to say, and correct me if I'm wrong or fill in details, like it was goal number one I remember was just to let it heal.
Rest, heal.
Heal. I mean, that's why I was in, I literally could not bend my elbow very well. I couldn't move my fingers except for the tips. I had it on both hands.
Tendons.
Which took a while, though. I mean, it was like, I think I even started asking you, like, what can I do to make this better? And it was like, nothing but do nothing, rest.
So we had to let it rest, let those tendons heal. Little things we want to think about is decrease inflammation, bring in blood flow. So we talked maybe about like ice or heat at home. We talked a lot about massage, bring in blood flow into those areas. We did some ultrasound, like electrical modalities to try to help bring in that blood flow.
Every time I saw Carly, she would
we have a gua sha tool
do this,
to just do some massage and like scraping of the tendons and the muscles. we looked proximally. So like I looked at Dan's shoulders. Like, are you tight proximally? Are we having problems there? Is that why you're overcompensating in like your elbow and your hand? So he was tight with what I call like internal rotation. So when I say
That's right.
how high up your back can you like scratch, if you had a scratch back there,
My right arm
was a
like,
lot tighter. So we worked on some
Yeah.
stretching of the shoulder, some like just engaging of the back muscles, because I can't have him gripping heavy weights while he's rehabbing the hand. But what are some things we can do for shoulder back while that like elbow down is healing?
Which was like theoretically some of that stiffness and lack of flexibility and strength in those areas was kind of
Could
what
be
started,
contributing.
or
Yep.
at least wasn't
Yep.
helping. Yeah, I
Yep.
remember when there was probably like, you probably have it in your notes, but like fourth, fifth time that I saw you, you asked me to put my right hand behind my back. And you had another like, oh yeah, that's you can barely do that.
Right,
That's
right.
not normal.
Exactly.
You're very stiff. Yeah.
Yep.
And I did them, and they worked.
You did.
Um,
You were diligent, which I know when a person has a passion, they're going to be that much more diligent to want to get back to doing their exercises and listening and being a good patient.
but I think the lesson I learned there too was, I mean, it was frankly easy for me when it's like throwing you under the bus, but like you basically said, no, you have to stop fishing. And it's January, February, March, the season's getting closer and closer. It was very easy for me to do everything Carlie said. I think it'd be much harder to, like even now, remind myself to do these things, remind folks like Josh to do these things. Like we all need to stretch.
Yep.
And we'll get into some of that preemptive stuff, but we're all likely on the way to feeling this, even if you're 21 years old or
Yep.
55 years old fishing.
Age does not matter.
yeah.
That is also what the research said. So they could not find any correlation between age when they looked at, they sent a lot of the research I found, most of it sent out like surveys to fly fishermen or fly fishing guides. And then they kind of broke down like all the things that they do, like casting style, grip style, how many days do you fish, how many years have you been fishing? So when they looked at like different correlations between different factors, age was not a factor. So it can happen to anybody. You just got to be really mindful of your form and be really diligent in some of the things you're doing in the off season or just when you're not fishing, that we'll talk about. So
Yeah. It's not just tying flies in the off season, ladies and gentlemen. It's physical. And I there's a lot of things that Carlie said that I was like bummed to hear just because I had to internalize it. But I remember one thing that made me smile and laugh was when she basically compared musky fly fishing to an athletic sport. You know, which made me feel good. You know, got to my head a little bit, maybe. So yeah, we're athletes, everybody. You heard it right here. We're athletes.
are.
We're superior athletes to most other anglers. She didn't say that part. That's just me. But no, I think
Absolutely.
that was like funny and also pretty
Yeah.
genuine. Like, oh yeah, we need to take care of our bodies, duh. But
yeah, think of yourself as an athlete. Train, you know, if you did soccer growing
Yep,
up,
yep,
yeah,
we did,
so
yep.
you didn't always kick a soccer ball all day long. They had you doing warm-ups, stretches, different drills. So
strength training,
strength
conditioning.
training, yep. So they have you do it all, so it's not all just
All lower
over
body
years.
too. Maybe that's why my upper body is so stiff and not strong. But yeah, you're exactly right.
Yes.
I guess Josh, from your perspective, like you didn't see a physical therapist, but I know you've had some like flare-ups or maybe like are on the front end of this. Has there been anything like from my perspective, like gone down the path? It was shitty. You should all avoid this. You don't want to have to do this stuff and stop fishing. Is there anything on the front end that you like took from this? Obviously, we talked about it the whole time. Or, you know, like I said, flare-ups that you've seen that you kind of had to address early on?
Yeah, we had kind of an impromptu support group about 2 seasons ago when we were both going through some struggles. I had a lot of shoulder issues. I have a background in rock climbing and pole vaulting, so that was very tough on my upper body, and I think that's kind of translating now to hucking these big fly rods around. The thing that really saved me was that off season. It was getting really bad in the fall, but I was able to rest it for several months during that off season, and it seemed to help out a lot. I have been noticing a couple things in my forearm though, so I'm looking forward to hearing about some of these stretches that we can take away after today's episode and start applying those in a daily routine.
Yeah, that like every time before I go fishing every night. I had to do it like midway through fishing today. Just like you can feel it now. I'm thinking about it more.
Yep.
But
Yep.
but yeah, that's true. And I guess just a shout out too. We're gonna we could probably talk for several hours on all of the research and some of the stretches and techniques. We are gonna have a pretty lengthy podcast note. Again, shout out to Carlie for helping us fill that up, where some of this material will be available. So we're probably going to paint some broad strokes here, but all those details can always reach out to us. Please don't spam Carlie. This is not going to be an invite for every angler in the world to email her about questions. That's not what she wants. But you can spam us all day long, and we'll tell you all about all these new toys that you need. But good. Anything else that you think is noteworthy about like how we started working together, and like, I mean, we're going to get into some of the high level stuff on that in a second, but I think we covered most of it. I'm just looking at the notes. Yeah. So now I think the second piece of this, you got the idea of why we're here, how Carlie met me, how she started helping me, what stupid injuries that I went through. The rest of this is hopefully going to be more geared toward how we can all avoid this, going forward as we age, as we fish more, and then, what to kind of do if stuff starts to flare up. I think especially geared, we know it. We joke about it as musky anglers, how hard it is and the grind. And, I was definitely fell victim, I guess, to wearing it as a badge of honor. Like, can you cast 10 hours straight and not see anything? Yes. And like, that was kind of you're hardcore. And I think that was like also a mentality that we have to accept as anglers that fish for musky when you go into it, because it's not pan fishing where you're sitting down in a chair and you're catching fish all day. You're working hard. But I also kind of had to accept the inverse of that, which was like, frankly, let go of that ego and take breaks and do all this work.
Create new habits.
Yeah.
Yep.
So I guess from what you've heard from me and what you have, the research you've done, like what is it about fly fishing and kind of specifically the musky stuff, the big heavy rods, and this can apply not just to fly fishing for musky because you have some experience with that.
Right.
But what is it about that what are the factors that we have to be aware of? I know we've talked about a few of them that like lead us down these paths of injury that we're talking about.
I think it's pretty just overall fairly simple in the fact that you guys have heavier rods, heavier flies. You add weight, right? So you're adding weight. So sinking flies, shooting heads, all of that is added extra weight onto the casting mechanics just in general. So the fact that you're adding all that added weight onto the cast is just overall just more force into the arm. So, and then if you add the haul with it too, single or double haul,
now you're using both.
Added mechanics now for both sides. So,
which is a lot of why my left hand was also injured. But yes, keep going.
With the hauling. So, those who are going to fish for larger fish in the research showed a higher prevalence of severe pain after casting because of the more strength and power that's required. It said
I was going to ask that. Interesting.
31% of those who fished for. So a lot of the research was more like saltwater heavy fish. They didn't necessarily specify
totally applies
musky,
though. Totally
but,
applies.
Anytime they talked about saltwater, I was like, okay, there's like that focus for more of like musky anglers. So 31% reported moderate to severe pain after casting versus 19% of those who are not fishing for a heavy game. So they just talked about trying to choose the lightest rod possible when you are choosing the type of fish you're going to look for, which probably pretty simple, and that's probably what you guys do.
Yep.
Thinking about shifting your hand on the location of that rod handle. So something I never thought about was like a rod to reel balance. But you can choose certain reels with your rods and like placement of your hand so that it can more balance in your hand. So if you're too far up on the rod, then you're pulling the wrist maybe down this way, which could develop more of like a pinky side tendonitis. But if you're too far down on the rod, then the rod is maybe heavier, so then you're maybe holding the rod more like this, which could develop a thumb side tendonitis. So really being mindful of like when you are holding the rod in your hand, you got to keep wrist straight. If you snap or break the wrist at all, those smaller muscle groups are just going to wear out so much quicker, and that's why you want to focus more on like shoulder, elbow when you're casting mechanics.
I'm smiling because we did not prep her for that, but yes, she just told you all that you can't break your wrist fly casting. If you've done fly casting lessons or you've been in the guide boat with us, you've probably heard us say that. It's because it doesn't help your cast, and now you hear that's what's causing injury as well. So.
Yep, absolutely. So they looked at, in the surveys, they asked like what size like rods are you holding? The average was 5 pounds, and the average side length.
The 5 weight. Yeah, which would make
pounds.
sense. Yep.
And then length, 9 feet was average.
Exactly.
But every foot of length that you added to your rod, you increased your chance of injury by 46%, is what they found. So every foot that you add to that rod length.
Interesting.
So I don't know how long.
I think we start to play where this is like an interesting intersection and almost inevitable, and this is where I know Josh had to tell me to stop doing some of these things. Was the especially with musky, there's just this like we want to cast bigger flies. It's not. Some of it might be because people like looking at them, but we really do it because we think it's going to work to catch the fish. That's why we're there.
Yep.
Those bigger flies then require longer and bigger rods to cast them more easily. But we're, as we go down that path, we're not saying don't do that. Carly might be, but obviously from a musky fishing, I think the risk goes up.
Yep.
Being in a similar situation to what I was in.
Yep. So a lot of this is going to be perfecting your cast, like practice, even in the off season. Do kind of like full body scans, like try to feel where you're holding maybe more of your tension as you're casting. Keep your elbow as close to your body as possible, because as soon as that elbow breaks out further, then you're more likely to develop some like elbow forearm like pains, tendinitises. So the rod needs to stay as close to the forearm, right? Don't break that angle. And then the elbow as close in as possible to your body.
Which is, again, interesting because that is proper casting technique to more efficiently deliver a fly, which makes sense that it's also, like, efficiently deliver a fly is fishing speak for, don't hurt your body while doing this. Yeah.
Yes. And a lot of the research talked about just mastering master the short casts first. Then once you build up that accuracy and that strength a little better, then go into some of your longer, further casts.
Sure.
So
you talked about, just a second ago, you talked about the grip too. And is that, is that something that like, and I know the research might be limited here and you might have to make some judgments, but is that something that like, if you're holding a rod one way all day, is it something you should change up to just not do the same repetitive, I have my hand right here, especially like where some of the hand injury does come in is like after you cast musky fishing, you're holding, for lack of a prop, you're holding the rod right here and stripping all day long, in the same position, and my motion is kind of like this. And I'm probably gripping down or gripping over here. So is it like maybe switching up? Or is there a proper way that we should just always do?
So it talks about trying to vary. It talked about vary your cast style, vary grip. So let's start with the grip.
Perfect.
You showed me what's called thumb on top grip. I don't know if you can see that. Okay, so thumb on top, just kind of like following with the rod. That is thumb on top grip. The other kind of grip styles they talked about, finger on top. This one is the worst. So don't do this one if you can avoid it. And then V grip, which was more of like a wrap, and then the thumb wraps around and you end up more with like a V-style grip here. So for your grip, it matters. So all people who said that they held with index finger pointing on top, every single one of them reported pain. So I think of more maybe like those maybe just the lighter rods maybe.
Yeah, I don't even think we could get away with that for musky fishing.
You need a stronger
but for like trout
grip.
Fishing, you could get away with it, but you're still putting yourself at risk of injury.
Yes, because when I think of finger on top, you're putting yourself into what we call pronation, which is palm down, which is just asking for some like
Yeah,
tennis
you can
elbow
feel it
there.
as soon as
Yep.
you do it.
As
your
soon as
muscles
you reach
engage.
out, you
Yeah.
are pinpointing all this muscle and weight to anchor right to your elbow. So if you can do more thumb on top, and then maybe when you're getting a little fatigued with thumb on top, change to more of that V grip style. Like just kind of get a little used to just that little bit of that rotation, because truly just adding that slight bit of rotation is going to just kick in different muscle groups. Right. So definitely varying your grip style is super, super important.
That's awesome. That's incredible. And I think another question, but I think to prompt it a little bit, especially for the listeners, is where I noticed the pain begin, and when I like reflected back on it, it was, and maybe Josh, you had similar experiences when we were kind of going through our little mutual support group in 2021 when that all kind of started, was big flies, and really trying to, I think I'll let you answer for yourself, but I remember trying to take, proper, what had been described as proper fly casting technique and what I had learned to do, and applying it to bigger and bigger flies, and it started to break down. I could feel as soon as that rod would accelerate to a stop, I'd feel just all of the shock come through my arm into my elbow. And even like Belgian casting, which we've talked a little bit about in the podcast, or just in other forums, on an efficient way to single hand cast big musky flies. If you didn't do it perfectly, or I remember things that would like flare it up was you wanted to make an adjustment mid cast, or especially the across the body casting, the opposite direction. It was a little bit more difficult to do a Belgian cast, like those little things. But it was the onset of it was definitely situations where a heavy fly and I would accelerate to a stop. I remembered that pain. So it became exclusively kind of Belgian casting because I did not stop fishing heavy flies. And then that led a little bit to the two-hand casting of like, it literally hurt so bad. I was like, well, I'm going to use two hands here because that helps. I don't know about you, Josh, but was there like certain things that you do fishing that you noticed it with your shoulder or with your elbow? Like that, especially that, like I just talked about, that we're not supposed to do, but we're in the heat of the moment. We just do it anyway.
Yeah, when you're trying to reach out for that extra little like curve in your cast to get around a tree or something, that I think that's what Carly's talking about. You're extending that elbow and that shoulder away from your body, and that's putting so much strain when you're hooking these big flies and lines around. And then, that backward motion, that was just excruciating towards the end of that season. I remember it got to the point where like halfway through the cast, my arm would basically just fall off,
Yeah.
Ugh.
Yeah.
That was brutal.
And it also, I think, in being weak, it forced me to recognize that, like how important the double haul is. I think the double haul, if you're not double hauling in musky fly fishing or two-hand casting, A, you're not going to get your fly far enough, more efficiently enough, and B, as you're saying, you're just going to injure yourself. When you're proper double hauling, the left hand does so much of the force. Double haul plus a Belgian cast takes that strain off, changing up your grip a little bit. So those are some of the high level things.
Do you guys just do overhead? Is that what you guys would say is? So
typically for like in the upper Midwest, again, where most of our fishing is done, most of our customers, listeners are, the overhead casting is typically, if you'd like Google a video about how to fly cast, it'd probably be what they'd show you. It's how we first teach someone how to fly cast. It's how we trout fish, I guess, generally, because you're always mixing it up, trout fishing. From a musky perspective, it's very much usually to the side, 45 degrees.
Elliptical then, so sidearm then overhead?
So that is what you just did is a Belgian cast.
Oh,
yeah, okay. But it doesn't have this accelerate to a stop. It's elliptical and it never stops, so it helps you never have that shock. And then it also helps because the weight of all the heavy stuff, gravity takes over, and if you accelerate, I hit the mic, darn it. If you accelerate to a stop, all that stuff
that energy
starts to fall.
Yeah.
But yeah, we are pretty much 45 to the side or close to, and generally pretty elliptical. That can vary.
Yep.
And
but you made a react. You had go ahead, Josh.
Yeah,
Carlie did have a
Josh.
reaction I want to get to though.
Yeah, and I that's a good point. Like in the trout world, I think, and when you teach a lot of people, you want to tell them to keep that rod straight up. But then as you get into the bigger game, the bigger flies and everything, you start to get that rod. I'm not on camera anymore. You start to get that rod way out to the side, and maybe it's the fear of that, fly going 250 miles an hour that weighs a pound when it's saturated with water hitting you in the head. But I know that's not good for your arm or your body.
Yeah. Yes. So when they looked at casting style, they lumped Belgian / elliptical and sidearm kind of into the same category, that it increased your forearm and wrist pain when you did that elliptical Belgian sidearm.
Interesting.
So they found that overhead caused the least amount of pain.
And why would from our bodies?
I think that's because it's mainly just coming from shoulder.
Got it.
As soon as you break this sagittal plane and you come outside, then you're just the weight is just transferring out into wrist, elbow, hand here. So
that's why I personally never had a lot of shoulder issues. My shoulder was tight, but that was not where the source of pain was or injury.
Right. Yep. So overhead was found to be the least amount of pain.
Interesting.
And elliptical Belgian sidearm had more wrist elbow pain when they looked at it. Yeah.
But I think that's what's so interesting about this conversation, at least to me and Josh, because we're nerds about this, and you too, we're shared nerds about all of this.
Yeah.
But maybe not the musky part. But we really don't recommend that people overhead cast.
Sure.
I can't recommend it. I don't want to do it. I sure don't want to be in a boat with 10-mile-an-hour wind and a fly this big. Like Josh said, casting a fly near my head.
Yeah.
First, the fly is way higher up, so it just is more subject to wind. So we do recommend the elliptical.
Sure.
I think this is maybe where we can get into two-hand.
Yep.
But that it kind of goes back to what we said earlier. So if that's the path we're going to choose, we have to prepare our bodies for it. We have to strengthen them. We have to, rehabilitate them when they're in.
Stretch them, take breaks. Would you throw a couple overhead and then a couple Belgian, or you kind of just stick with that the whole time?
I think what we have found, obviously gear, and Josh, feel free to chime in too. It depends on the gear. You're throwing a smaller fly on a 10-weight rod. You can throw a very tight loop easily, a little bit more overhead. You start throwing bigger double hook flies, some of the glider flies we talk about on the podcast, big top water flies, and you really don't have a choice. But where we've seen, we've started, and we just posted this the other day, brand new custom two-handed rod, and that allows us, I think, to come back over the top a little bit, or at least less to the side, less elliptical. And obviously just in general takes less load off all of these parts, because it's not, your left hand starts driving the bus a little bit more instead of everything going into your right hand.
Yep. So research, when they were looking at it, said 80% of the time the right side was affected,
which is the
mainly
casting
the
side.
more dominant side for people. But yeah, they said that two-handed casting is becoming more popular, which will allow for longer rods, more shooting heads, sinking weights, casting longer distances, and less likely of injuring that one arm. Kind of redistributes the load to both sides, like you just said. So, that's interesting that you got a new rod.
Yeah,
that does that.
It's we've had a couple, and we've been doing it with a couple, but this was like a special, again, kind of the musky nerdy stuff, a very special brand that made a musky rod, RB Miser, for those folks that didn't see the announcement. We can talk more about those at a later date, but that's why at least I got so obsessed with the two-hand casting, and not just the water loading, which is for Carlie's background, when we basically slap the fly and use the water tension to load the rod instead of that loop that we throw in the air. I had problems with that. That felt like a lot of it was almost like lifting a 10-pound weight with the fly rod. and it would kind of give you this. I don't know if you've experienced this, Josh, but sometimes when you like water load, and you wouldn't time it right, and the fly's too saturated, the line starts to sink a little bit. You'd go to load it up, and it would just like break your body. And I found that could kind of like cause stress as opposed to keeping the fly up in the air.
Mm-hmm.
So that's like the path we took. Yep. Go ahead.
Yeah, when you start shocking it, that's when you really can feel it in your body. You want to keep that a fluid motion if all possible. Mm-hmm. I even heard a story at one point. This guy, he had fished several days in a row, didn't see any musky activity, and then on his back cast, his cast was lazy and his fly landed in the water. A muskie actually ate it right at that second. He loaded up and he tore his rotator coming through for that forward cast. I can't imagine.
That's a wild story.
I have a question for Carlie.
Yeah.
Dan, during your therapy, did you bring your fly rod into your sessions to show Carlie how you were casting?
We talked about it. We did not end up doing that, but that was also because that was kind of it was when you hadn't started doing the research yet, and then you started. I remember because I was going to bring it in, and then the appointment I came to, Carlie started talking about hauling and elliptical casts, and I was like, holy shit, what the hell's going on?
Wow.
Yeah, she was teaching me about fly casting all of a sudden, and it was nuts. So
we talked a little bit about technique and like what you do when you cast.
Yep.
Yeah, but we definitely didn't get to dive like this deep into it, which is good.
I was going to ask if there was anything specifically you saw in Dan's technique that was possibly causing those injuries.
Well, now knowing that you do more of that elliptical, because I think in my head I thought that musky fish anglers did more overhead just because it's more weight.
Yep.
So
well,
now,
and traditional bait casters are definitely casted a little bit more overhead.
That's probably like I'm just thinking of my dad. So, yeah, knowing that you guys do more of that Belgian style, I can see why it went more into his wrist and hand, just with all that force kind of coming through.
And especially hand, if the force is going into your elbow.
Yep.
And then your elbow gets injured and you start babying it and over gripping.
Yeah.
Then it just torched my hand.
Yeah, and all the muscles in like your fingers in your wrist and your forearm, they all come and they insert to your elbow. So that elbow is the originating spot to all of your forearm, hand, wrist muscles. So if you start to notice elbow pain, forearm pain, it's kind of like the beginning stages of like a tendonitis developing, and then you're overcompensating and overusing other small muscles, and then it just transferred right down into the hand. Yeah.
I remember that because like a stretch that you had that we talked about was just like this, and really putting pressure inwards this way. And
then that way. Yep.
And then when I first had the injuries, like putting a fist and going like this, I couldn't even do it.
Right.
My whole hand would, it would just like, it was so painful up here, but
Everything
it
was
really,
so
you
tight.
can feel all of that connected, which
Yep.
didn't know that. Some of you guys might have. I did not. Yeah, that's a good question, though, Josh. I think, and just, Carlie and I have not talked about all these things, so just like I'm learning right now, like it was for sure the elliptical, 12 weights, big flies was
So,
like the cause, for sure.
If you're gonna, like, could you bring 2 different rods? Like in the boat, and maybe like use your longer one, and then like after an hour take a break, maybe switch to a smaller rod and just do like smaller casts, more elliptical versus overhead.
And I think we're exploring these things like in real time, so it's like I want to go, but it also, it kind of, Josh, makes me think like you should overgun your rod, and like even if you're throwing small flies, you should throw it on a 12 weight because you're less likely to require the Belgian cast. You know, you're more likely to be able to just keep it overhead. So that's interesting. I might be interpreting that the wrong way, though. We should all just probably, stop musky fishing and go back to trout, I guess.
That's not the goal. That's not the goal for today.
Damn it. So, question for you. In some of the other research you did, were some of the injuries you saw with me popping up?
Yep.
And then B,
Totally.
what other serious, Josh even mentioned rotator cuff, what
Yeah.
other injuries were popping up?
Yeah.
Or what other parts?
Good question. So this was one specific study in 2020. They got 162 fly fishermen to respond. They asked them, how many days do you fish? Average was 30. How many years have you been fishing? Average was 30 years. On average, how many casts do you make a day? They said 200 casts. And then on average, how many consecutive days will you fish in a row? The average was 3. So 37% of those fly fishermen reported pain after fly fishing. The most common injuries, rotator cuff tendonitis, just shoulder joint pain, elbow tendonitis, so golfers or tennis elbow, most people know of it as, bicep tendonitis, wrist hand pain, trigger finger, and then carpal tunnel were the most reported. And then another one looked at specifically just fly fishing instructors. 292 of them responded in a survey. 50% of them reported shoulder pain, 39% elbow pain, 36% wrist pain. 74% reported pain in at least one of those 3 locations, and 27% of them said that they tried to change their casting style because they started to get pain. So yeah, it's just overall just that upper extremities just taking a lot of the load when you guys are casting. Looking at why are you stressing those parts of your body? Montana State University did a really cool study where they looked at joint velocity in shoulder, elbow, wrist, and for those who fished 10 days a year or less, showed the most velocity in the wrist. So they were breaking the wrist, and just when it traveled down the chain, they were just using too much with the wrist. But
Which would seemingly correlate with less experienced beginner fish.
Exactly.
Yeah, okay.
But for those who had been fishing for years, they saw the highest velocity was coming from that shoulder. So definitely when you are practicing your throw, try to get that most muscle coming from shoulder and back, like we talked about. But do you guys ever practice casting?
Yeah, absolutely.
In your backyard or?
Yeah, well, it's funny because we'll do it very often. We're probably going to do it with somebody today at the shop right in the back alley.
Okay.
When I got some of these new 2-hand rods, I don't want to speak for Josh, but it's a theme because, you kind of feel silly because it already kind of looks silly if you don't know what it is.
Yeah.
When we're out on the lake or the river, people always stop you or what are you doing? But then when you do it in the park, they're like, are there any fish in there? How are they biting? They're just very confused with what's going on. But yeah, generally speaking, we do. I have some things to practice apparently. Just listening to you talk. But,
Good.
yeah.
Good.
But
Yeah.
it's starting to click at a deeper level because what I also heard you just say, correct me if I'm wrong, is you should be engaging your bigger muscles, your shoulder and your back to cast. Especially so, I think what we're learning here is it just gets magnified when we do musky. The rods are bigger, the flies are bigger. We want to cast as far as possible, and we're fishing for as long as possible because we never catch any fish, so we're casting a lot. So that's if I look at myself again, that's where I was the stiffest and weakest was back muscles, shoulder muscles, which is why it felt I was why did this get so bad? So I don't know, Josh, if you have any questions on this, but I was going to kind of transition us to how do we prevent this? How do we get stronger? How do our listeners, what should we be doing kind of at a high level and then getting ourselves down into some of the nitty gritty things? Well, obviously, again, I'll repeat it. We'll share a lot of this in notes. It will probably be pretty extensive, but kind of take it away on that end.
Yeah, so thinking about trying to prevent injury and just keep your body in good shape. You joked about me telling you you're an athlete. Think of yourself as an athlete. It's silly, but if you're ever asking your body to do something for hours on end, that's when things become repetitive. So truly in my job, I see more of people that are typing all day long than I do construction workers. And why is that? Because their small muscle groups are just overworking for 8-10 hours a day. So think of yourself as an athlete, try to keep yourself in as best shape as possible. We talked about something as simple as just put good nutrients into your body when you can.
Turns out beer is not it does not help your muscles. It gets you puffy in your hands.
Yeah.
So, the 30 rack of hams as your nutrient source musky fishing. I hate to be the guy to say it, but it probably needs to be replaced with a little bit of water.
Yeah, make sure you hydrate for sure when you're out on the lake.
It's terrible, though, because, if you look at us, we're going musky fishing, and we immediately we joke that we become pirates. It's like we live off Quick Trip, salty snacks, and beer. And it's like, well, that's not helping whatsoever. It's hurting us.
Exactly. So talking about just trying to get a variety of what you do in your, couple weeks. Get some strengthening in. I don't know if you have a gym membership or not, but get some strengthening in, get some cardio in, aerobic exercise, and then yoga Pilates, because like we noticed with Dan, his shoulder was getting really tight. So by just working on some simple bilateral kind of stretching, get that stiffness worked out, maybe your lower back. So doing some yoga Pilates, all of that is really good. Get some core strength in, because if you have good strength proximally, core, back, shoulder, then that's going to allow your distal extremities to perform better too. And we'll talk about strengthening, stretching that too. But not saying you have to go get a yoga or Pilates membership, but there's so many good things on YouTube. So
and even the things you said, it wasn't like I had to do an hour of yoga. No. I had, 30, 45 minutes of stuff, but it even just a little bit.
Yep.
Even just very simple stretches, very simple back stretches, just the repetitive close. It all
open up. We're always forward, so opening up back is really good. Do you guys do a warm up before you?
Absolutely never. Not before I met you. Okay. Never. I don't know about Josh, but never. Warm up is it's 5 a.m. You're cold.
Yeah.
You get out of the car and you start casting right away. Not even. I never even thought about it.
Yeah, so...
Yeah, as I get older, I do very little. Sometimes I'll swing my arms around, at the beginning of the day, but that's about the extent of it.
Yep. So just, especially if you're in cold temperatures, right, you just want to make sure that, if your hands start to get cold, I don't know if you guys do wear gloves.
Well, let's pin that. I'm going to ask, yes, and I think we talked about that, actually. I remember the cold temperature thing is another layer in all this, because it's musky fishing, so we all like to fish in the cold. Cold temperatures are usually good fishing, spring and especially fall. We're going literally into ice up. We want to be fishing.
Yep.
Gloves are interesting. I think we all wear them when we have to by the end of the season, but it does inhibit some of the stripping and the casting, and it's so tactile with the line that you got to wear fingerless gloves or stuff like that.
Fingerless would be a good option, because it's still providing a barrier to just help keep in some of that warmth and blood flow into the hand.
But I remember you saying, and it was another aha moment I had of even though my hands are cold and I'm okay with the cold pain, it's actually casting repetitively when my hands are cold is leading to more injury, probably why it got really bad in October and November. I just didn't have the blood flow in my hands, and then I was doing this repetitive action all year.
Yep, absolutely. So good dry fit layers, then maybe some raincoats just to stop from maybe if anything is
hand warmers.
Hand warmers are
all
perfect.
Things we know and we do use, but you're kind of no, I'm fine. I'm going to keep fishing.
I think it's so silly, but it's really not. They even make electric hand warmers out there, so you could charge them up and then bring them fishing, so you don't always have to open up the ones that take a little bit to heat up. Even your simple walk from your car to whatever location it is that you're going to go fish, that gets blood flowing a little bit, which is good. Josh, you talked about just kind of doing arm circles is really good. If you did a little bend at your hip and let your arm hang and kind of did more pendulums that way, that's going to pull blood flow into the hands better that way. Get some core, do some twists at your core there just to get a little bit more core engaged. Get some wrist stretches in. So, Josh,
I'll show you my whole new program, Josh. Don't worry. I got a warm up routine.
Kind of coming out like this.
Heck yeah.
And just doing some wrist stretching is really good. Both directions. Now palm up, pushing back, just to get everything loosened up there.
Even the little, I still even if they're not stiff, I'm doing the hook fist.
Yeah.
Or even some of these.
Spreading open is really good. They sound so simple, but it's it does help. And my philosophy is if you could just stop every 1 to 2 hours and just give the arm a little bit of a break, just come do some stretches.
Drink some water,
Drink
not some beer.
throw some sips of water in there for sure. When you are gripping all day long, that is your flexors. So you want to work on strengthening extensors. So I have a rubber band around my wrist, but working on strengthening extensors, which is kind of one of the putty exercises I have you doing.
Yep.
Just really working these really small muscle groups on the opposite side. Because one of the most interesting things I found in my research is like rehabbing fly fishermen. We can't treat you like a normal overhead throwing athlete. And that is because you guys use both sides of all your joints kind of more evenly. Where like
because we go backwards and forwards, not just throwing a baseball.
Yeah, which is just all forward.
Got it.
So I found that really interesting, which I feel like will help me as a therapist help rehab, because we got to be thinking back and forward on both sides of every joint, because you had it both sides of your hand.
That's right.
But people could be getting it on both sides of their shoulder, not just the rotator cuff side. So I did find that super interesting that you guys really have to work on both planes of the body.
And like the other thing I hear you saying that was interesting is I was just playing out like a normal day for us, Josh, which is if we are fishing on a river in a rowboat, or if we are fishing on a river in a rowboat, when do you take a break?
Oh.
When you're rowing.
When you're rowing.
That's your break. So now you're gripping and you're doing this the whole time.
Yep.
Which isn't really a break.
Right.
You know, maybe we need like a communal yoga on the riverbank break.
Or can you do a paddle boat and use your feet?
Yeah. And then we might have to invent that. And then, or now we're back to kayaks. And then if we're in a boat with a trolling motor, you're like, today, Josh, Gabe, and I did not take a break because the motor's doing it for us. I mean, you know, we didn't fish for that long, but like we're like, oh no, great. The trolling motor's here. We can fish the whole time.
Yeah.
I think when that third buddy comes into the boat, whether, you know, that's a good time to sit there. And now we're going to look so weird, though, because we're going to have two people fly fishing on either end of the boat and one person doing yoga in the middle of the boat. They're going to think we've lost our minds, but it's all for Musky.
Oh, that's funny. Yeah.
There's also a theme here. Go ahead. You're going to say something, Carly.
Oh, I was just saying then you just have the two flies in and the one person doing their break, and then you can rotate out. That sounds good.
Exactly. More breaks. You're hearing it here. There also seems to be this like subtle theme. I think I've talked to you a little bit about this, where it is a little like break with this traditional theme of ego, where, you know, like your body's not supposed to do this the whole time. And like we're kind of taught in like the musky ethos of like suck it up. Muskies don't care how you feel. Keep casting, like cast the fish of 10,000 casts. Yeah. Figure eight every single time.
Yeah.
Even if you're cold, or even if like your body is cold, but your mind has overpowered that.
Yeah.
You still don't have blood flow in your hands.
Yeah.
So just kind of accepting that, like, yeah, you can power through this stuff, and I think I tried that for a whole year. It's going to catch up to you.
Yeah.
And I think it's both not powering through it and doing some of the things you're talking about, even if you don't have injury yet.
Yes.
Like that's the magic, right?
Preventative is the best thing, because as soon as it sets in, then that's when you'll get frustrated and maybe overcompensate. But yeah, preventative, and then if pain does set in, come see a local hand therapist or occupational therapist, and we'll give you some tips and tricks for sure on just how to stop that, get it healed maybe a little faster before it gets a little more out of control.
Yeah.
Yeah.
I don't want to throw anyone under the bus. I'm not going to name any names, but if you know, you need to reach out to someone. I'm just going to go out on a limb, and you're a hand therapist, and you need to consult with someone. I encourage calling Carly, because the first person I saw, they didn't laugh at me, but they're like, this isn't from fishing. What do you do? You're fishing. You're having fun. There's no way you injured your whole body doing this. And you just kind of had an open mind about it. And we're like, that makes sense, actually, when you explain it.
Yeah.
It's kind of weird, but.
Yeah. You're doing what?
Yeah. Yeah.
But yes, I could totally like just kind of see a correlation of just that there was something that was happening, and that's where that your arm was starting to kind of break down as far as where the pain settled in. Absolutely.
I would also like.
Yeah,
we should have like.
I feel like this
we should
is
have like.
helpful in
Yeah,
some of my
these
preventative techniques.
These are useful. So 2 things that she gave me. She's going to explain one of them. Like beyond. Like honestly, this is like they kind of come with me now because like I know at least when I'm using these things, I'm strengthening things that are
blood flow,
breaking while I'm fishing.
Yep.
So you have very simply just like putty, and we'll link to some exercises where I'm mainly hand, right? This is like pretty much hand
mainly
exercise.
hand, but that does target then like forearm, elbow too. The hand has a lot of very intricate muscles in it. So TheraPutty is different than Play-Doh. They're not the same. This has like some resistance to it when you go to do that like grip and squeeze. But yeah, we talked about you can use it to kind of strengthen. See my hands, I gave you kind of the stronger putty. My hands can't necessarily do this putty super well.
It works, like especially like the stuff I couldn't do. Where I was like, oh my god, my pinky's really weak. By the way, this is probably going to be a podcast you're going to want to watch, everyone. If you're listening, we're going through a lot. If you're listening, we got a lot of awesome demonstrations. Again, thank you to Carly. We got all sorts of gadgets here. We appreciate you listening, but this might be one that you want to watch as well because there's a lot of good stuff you might miss.
Try to explain it when I'm doing it, but if you wrap that putty like around your fingers, just like that rubber band technique, you get this like slow opening of the hand, which is going to strengthen the opposite side of the muscles you're using all day, every day long. This one's like of just different types of pinches, so pinching to each fingertip, and I think for you, as soon as you get to like ring finger, pinky, that can get quite weak.
Yep.
Another really good one is with the putty, like in between your fingers, and then you squeeze together. You can feel super weak when you do that, so just squeezing those fingers together. I have you doing hook fist.
Yep, that's like the most still.
So hook fist really works forearm muscles there because that targets, it goes outside of the hand muscles. Now we're into forearm muscles there. So there's all different types of putty that you can do.
It's also interesting to layer into, as I watched you do that, it reminded me of like 2 little things that we also do that I, in my head, was like, oh, I'm not fishing, therefore I'm resting. Tying leaders and tying flies.
Yes.
Also kept me injured. I was gripping on this little bobbin and cranking and gripping and little motions and then tying leaders. If you're tying musky leaders and you're using your hands to pull them tight, as someone who could barely use their hands, I'll tell you, it does affect your hands.
Yes.
I use pliers to pull tight because it hurt. It hurt a lot. So I think those are just like layering in. I didn't mean to interrupt you.
No, that's
some other little things that we do that we're like, oh, again, I'm in the off season. I'm tying flies. It's like, well, you're.
But same concepts apply. Take breaks, stretch. Yep. Gyro ball. This is a super simple thing you can get online.
My dog loves this, by the way. She tweaks out every time it starts flashing and going. She's like, you're playing with me. I'm like, no, I'm not. But
this one has the LED lights?
Yes.
Okay.
Yeah.
So gyro ball is really great. I told Dan to just put this in the boat maybe so he could just get that blood flow going to the hand. But it's quite simple. Of course, they're on Amazon.
Oh, yeah. That's where I got it.
$15, $16. So you wind up the ball on the inside, and then as soon as you let that ball go, it starts to rotate. But
it's the weirdest feeling too. You can't see it, but it like.
You can't describe it either. But I'm getting that ball rotating. You hear that it's very smooth in the pocket. So that means I'm just getting good rotation and control with my wrist and forearm here. If it clicks on you, that just means you're not getting that good push-pull technique.
I don't even know how to explain it. It's like this weird resistance that's like extremely powerful. Like
it really is. A lot of professional athletes use it. That's kind of how it came on our radar. But as soon as you get it going pretty quickly, so I'll get it sped up here. As soon as you get that going pretty quick, now it's like your hand's not doing really anything at all. But that pulling, that co-contraction with my muscles, it's getting that blood flow going. It's coming in through my whole arm.
And
you can practice some throwing, some forward and some back motions to get that whole shoulder going. So you could reach out like this to get some of just that whole reaching motion going. You do that for a couple minutes.
That's all you can really do.
Brings in blood flow. Yeah, you'll get weak, you'll fatigue, and then you just take a break. So that's a really
it's also kind of fun too.
It is
and you
fun.
gotta like
it's like a fidget toy.
Yeah, and you gotta like do it right, and I wasn't doing it right, and then it's like I kind of like it, and I'm obsessed with it.
As soon as I tell
we'll have to get you one for Christmas, Josh.
It's It's a good stocking
I
stuffer
actually have
present.
one, so we're good to go.
Oh, there you go.
Ew. Have you
Yep.
used it?
Yes. Yeah, not for a couple years, but I'm going to get back to it. You've inspired me.
Awesome. Why did you have it?
From the old rock climbing days, I got
Yes.
into that.
Rock, yeah. We could talk injuries about rock climbers. That's a different one that I see in the hand world, but
Oh,
that's great. Just a good, forearm strengthener, shoulder.
yep.
That's awesome.
Yeah, it's so goofy. Like, it wants to stay still, but your body's trying
Yep.
to move it around, and the resistance is perfect for that.
Yeah. Yeah.
I like those motions you were demonstrating, though, like
Mhm.
where you're almost doing a throw while you're gyrating that ball around, too.
Yeah.
I could see that really strengthening
Working.
all the muscle groups.
Yep. And specifically shoulder.
Yeah,
just to-
this one, like when I would, because when I remember when you were like, can you do
Work
this?
out.
And my like right arm was like caught. When I
Yeah.
do the gyro with my,
Stretch it out.
oh, I
Yep.
can feel the whole. Yep.
That's really good.
When I do the gyro,
Yep.
we're gonna.
That's,
We're gonna create a monster with this, but I kind of love it because it's all for good. It's like
It is.
you can't. It's gonna help you. It's gonna help
Yeah.
us fish more. It's
Yep.
gonna help us do the things we love. So
absolutely. This was used because Dan had pain on both sides. And so I don't want you sitting there like massaging your like one side that's painful if you're getting pain on both sides. So this is what I had him just kind of like rolling out like a foam roller basically for like forearm
Yep,
muscles.
yep.
That's just one I feel like we didn't talk about. But
and I even was doing like the hook.
oh, and then the
fist
hook,
with it.
yep,
Yep.
they let you kind of squeeze.
And that
Yep.
was mainly because of the hand injury. That was like the
Yes.
rehab. I remember.
Yes. Yeah.
So we're kind of coming up on time. This has been awesome. Let me just say that.
Good.
I mean,
It
I've
was-
learned so much from you, and I've learned even more in the last hour as you've
Awesome.
unpacked this.
That was my goal. My goal is to not make you be afraid that you're going to get pain because I don't want to do that. I want you to do the things you love. But if there are things you can do to prevent injury, that's the goal.
Yeah.
And think about how you're doing some of your things. Change up some of your habits. Take breaks.
Yep.
Simple things. So.
And I think as we kind of unfortunately point out, it's inevitable if you're going to be musky fishing or musky fly fishing. It's you're not supposed to really do this stuff over and over and over again. Yet the fish demand you to really do it over and over and over again. I go back to where we started, like what your dad said. He almost I don't want to speak for him, but he almost said it a little bit of like, I wish I could fish every day, but I have to pick the good days because otherwise I would hurt myself.
Yep.
And I don't want to get there. I know we're probably it's all inevitable at some point. Our bodies are going to decay, but like we want to last as long as we can
Yep.
and give ourselves a chance. Another shot at the champ, right, Josh?
Yep, absolutely.
Any other questions on your end, Bam Bam? I think this has been awesome.
This has been absolutely fascinating. Thank you so much,
Good.
Carly, for offering your insight and wisdom. Hopefully we can share the love and the knowledge
Yeah.
to everybody else on the water.
Exactly. Well, thank you. I've enjoyed this. This has made me be a better therapist. So, kind of understanding certain passions for people, and it was very fascinating. I enjoy reading research. So, yeah.
Who knew there was all this fly fishing
knew?
injury research?
Even Wisconsin Medical College did one.
Really?
So, yes. I was like, wow, this is local. That's
crazy.
cool.
That's
Yeah.
crazy.
So we'll list all my research in the notes because I didn't do the research. I just found it and then
Curated
presented
it.
on it.
Yep.
Mhm.
Digested it. Anything on your end that we missed that you'd like to share? I think we hit it all. We hit more than we even had notes on,
Yeah.
which was awesome.
Yeah. Just the big thing is just don't fish through pain. If you have
I would
that
say
pain,
that's the message.
don't fish through it. Come and if you're in the area, you're more than welcome to come and see me as a therapist. But if you're not in the area, find a local therapist. Don't fish through it, through the pain.
And there are ways to prevent it.
Yes.
For sure.
Yep.
That's what I unfortunately had to learn the hard way. Well, that should about do it for today, everyone. Thank you so much for listening. This is the 7th episode of the Spot Burn podcast. I've said it about 100 times, but I'm going to say it again. Huge thank you to you, Carly, for coming on, for helping me to educating all of us on this stuff. It is important. From an outsider looking in, they might think it's weird that we're taking it this seriously, but we all know that it means a lot to all of us. you know, you wear that passion on your sleeve sometimes, especially when it comes to fly fishing and muskies. And it is kind of serious stuff. We don't want you to get hurt. We don't want to get hurt. I think between some of the things Carlys talked about and some of the stuff you'll hear us talk more about from casting and two-hand casting and certain size rods, like it does, a lot of that comes from injury prevention. So we'll post a bunch of stuff. We got a lot of notes on our end, and thankfully you've been grateful to share them on your end. We'll make sure we get as much in the podcast notes, and probably, you know, talk about this continually. It's not something that will just go away. Whether we, you know, share some blog posts, keep everybody updated. You might even see some Instagram reels of Josh and I doing some yoga in the boat now. So, you know, again, like we said, we created a monster. But, yeah, and then big thank you to everybody who listens and watches, subscribes, likes, and comments. It means a lot. We really, really do appreciate it. We got more podcast episodes coming. If you are new, though, those likes, those shares, the subscribe, we really do appreciate it. That helps you not miss a beat, and it helps us know that there are like 14 people out there listening to this, which, you know, we're really grateful for that. But that's it for today. Have fun out on the water, everybody. We'll talk to you later.
Thanks, guys.
Thank you.
Thank you for listening to the Spot Burn Podcast. Coming to you from the dungeon, this podcast is presented by Musky Fool Fly Fishing Co. We want to thank our awesome sponsors, Portland Line Company and Stealth Craft Boats. We also want to thank all of you, our listeners, for tuning in, subscribing, sharing, and spreading the good word. If you haven't heard, go check us out at muskyfool.com. Have fun out there on the water, y'all.